starting a study in the systematic review, randomized cultural study like this. So you should have a clear question, as Dr. Nekufar, if you remember in the previous session, explained about it, and also Professor Khami. And today, this topic, defining a clear question in evidence-based dentistry, will be discussed. Now, I would like to introduce today's lecturer, our guest speaker, Professor Sadiq Khan from University of Western Cape, Cape Town, South Africa. I would like to welcome to her. Before listening to the speech of our guest lecturer, I would like to present a short biography of Professor Khan. She is associate professor and senior lecturer in restorative dentistry in University of Western Cape in South Africa. She got her bachelor degree in dentistry in 1990 and got her master degree in restorative dentistry in 2007. She had a fabulous research on minimizing mechanical prosthodontic intervention for adult populations with shortened dental arch in South Africa, and got her PhD degree in 2017. And now she is the president of South African Division of International Association of Dental Research. She has had a long list of valuable research studies and publications related to restorative dentistry and dental educational research. She has had several presentations in international conferences. Now we have the chance to have one of her presentation in for today's session. We'll be running a live question and answer at the end of session for about 15 minutes. You can write a question in the chat box during the workshop, and your question will be answered at the end of today's sessions. And Professor Khami, if you have any explanation about today's session, please present about it. Professor Khami?
Hello, can you hear me?
Yes.
Okay. I would like to also say hello and welcome to all of the participants. Thank you for starting the second session of our virtual evidence-based dentistry course. And I want to especially thank and welcome Professor Khan, who kindly accepted our invitation, and now we are so lucky to have her here and can use her experience in the field of research and evidence-based dentistry. I'm sure that all of the participants would learn many things today. Okay, I don't want to take time more.
Thank you. Professor Khan, the stage is yours, please.
Thank you. Thank you for such a beautiful introduction. I'm humbled by your kind words. Thank you for the opportunity, and thank you for those attending. Without them, there wouldn't be a workshop. Anyway, I hope my presentation is going to add value, of course. Yes, I have done a bit of evidence-based healthcare. I've extended myself in that way. And I'll speak a little bit about that because I've actually now included it for the last 3 years in our undergrad dentistry program at my university. I also teach it to postgrads, and of course I teach it to staff. So evidence-based healthcare and the principles thereof is very close to my heart. I will start my presentation. I think I'm going to stop the video, but I'll keep the of course, the sound, just so that we don't have any other interferences. But let me first share my screen with you, and we'll take it from there. I hope, just let me know, Fariba, if you can see my screen.
Yes, we can see, Professor Khan.
You want me to make it onto the... You want me to make it on the full slideshow?
No, it's not a full slideshow. Please change it to full slideshow.
I'm trying to, yes. Okay, there we go. I just wanted to change the video, so let me just go back to video and take where we are. Where are we now? Just stop the share for a moment, and I'm going to just switch the video off and then share with you. Thank you again, everybody. I see the program was quite specific as to what you wanted from me. And just from your introduction, I heard that you have spoken quite a bit about the principles of evidence-based healthcare. So forgive me if there's a bit of overlap. Before I start, let me tell you where I come from. This is my university. This is our big section of the university where our major university, but of course we are not based here. We're based at a hospital. And as you can see, we are 60 years old this year. So we're not that old, the university. But unfortunately, due to the pandemic, we've not had a real celebration of the 60 years. We are based in South Africa. This is a beautiful picture of Cape Town. Cape Town has everything: warm waters, cold waters, beautiful mountains, forests, whatever you want, you can have and find in Cape Town. We're based at the tip of Africa. That's where the two oceans come together, so we can show you that as well. So that's our beautiful Cape Town. Just a little bit about where we are. In the University of the Western Cape is actually based in 3 of the major hospitals in Cape Town. Firstly, at Tygerberg Hospital, which is a large hospital, so we have a little section, and that is our base. That's where we are. Groote Schuur Hospital, if you've ever heard anything about Cape Town, where the first heart transplant was conducted, and successfully so. Dentistry has a clinic right here in the outpatient section. Then we have the largest children's hospital in South Africa, or in Africa actually. So we see patients from all over Africa that come here, children that is, and dentistry has a clinic there as well. And then of course our faculty is split between 2 places, Tygerberg Hospital and the Mitchells Plain Medical Center. So we teach across those faculties. Plus, we have several other satellite clinics that we work in. So that's just a little bit of where I come from. I'm in the Department of Restorative Dentistry, but research is my passion, so I go across disciplines. So evidence-based healthcare, I've latched onto the medical faculty based next door by us, and I've learned lots of evidence-based healthcare and everything related to that. So I'd like to share that with you. So I am a lecturer, so this is where the whole structure of what I'm going to present to you comes from. I think my directive was to talk about the types of clinical questions that you get, how to develop these questions, the framework or frameworks for these specific questions, and steps to guide you to develop these questions. And of course, we'll do some examples as well. And as I said, I'm a lecturer, so I'm going to give you an exercise right from the start. While I'm busy with the presentation, I would like all of you that are busy, that are in the session, to create your own clinical question. Think about anything that you need answers for. So that's the exercise for now. And we'll speak a little bit more about that later on. Challenges, of course, I've listened to you. Firstly, there's going to be an overlap with what someone else has done, or maybe what someone else is still going to do. There's a challenge in terms of the diversity of the group of students. I got the latest update of your students, and maybe I'm lucky they're not all here, 369 of you, but there's a number of you and you come from different backgrounds. And so the challenge is the diversity of the group. I have no idea your level of understanding, your level of experience, whether you are novices or not. So please forgive me. I've tried to locate my presentation just following the basic principles. And so if it sounds a little bit too basic, just look past that and see what else you can take from the presentation. I'm also we speak about clinical questions and we speak about research questions, but we use those terms a little bit interchangeably. So that could be a challenge for people as well in their understanding, but I'll try and sort of separate the two and make it a little easier for you. And of course, being online is a great challenge. in terms of our communication with one another. You know, when we used to a workshop, you have a notice board and you have pens and pencils and you write and you have interaction on that level. So of course we don't have that. But do feel free to question and ask in the chats, WhatsApp. I will leave my email address with people as well at the end of the session. So I hope this will be of some guide and we'll take things ahead from here. Just to start and locate where we are and why we speak about clinical questions and research questions and the evidence related to it. You know, why is this so important for all of us? Firstly, and I think the most important thing is we want to improve our quality of care to our patients. We want to decrease the risk of adverse events that patients may experience with whatever treatments we advise them on. We need to decrease the risks to patients, improve not just the quality of care to patients, but also the quantity of care to patients. We want to also improve patients' quality of life. So whatever we're going to do is going to be based on those research questions and evidence that we obtain from it. It has been observed anecdotally and even with research that health systems do not use quality evidence optimally or as they should or as we expect them to use it. There are times when evidence is not used at all. So this causes inefficiency and a reduction in quality of life. Yes, we do get involved in continuous professional development programs to update our own knowledge by referring to evidence. But does this allow a change in clinical practices? Are we really taking that challenge on? So the goal of developing these research questions, we have different roles, you know, we have different responsibilities. So we sort of we sort of wear different kinds of hats. So, you know, the goal of developing these research questions and where these take you is the responsibility of clinicians and academics. But more importantly, it is also the patient's rights to receive the best treatment. So we must provide them with that. And if you're an academic and based in the education sector where I am, curriculum reviews annually are very important. So we need to include evidence when we do that as well. We also need to reflect on our current practices, but also on our current teachings. Are we using evidence-based teachings when we do when we teach across the disciplines? Also, most importantly, when you're in the education sector, we are researchers. We hope everybody is a researcher in the academic because that is what improves our positions in the academic space. So we are researchers. So we need to find, and the goal, that's the goal for research. But more importantly, we speak to practitioners as well. When we speak about clinical research and clinical questions, that's where those clinical questions come from practitioners in the public sector. And we speak about reading smartly, and I'll refer to that a little later. Of course, the most important part is clinical practices and how we change clinical practices using quality research or evidence. And this is the most difficult part. And this is where the gap is. We need to change our practices in line with the evidence that's available. So let's get down to the task of the day, which is talk about evidence-based healthcare and evidence-based dentistry. And as I said to you, I'm sure you've had this definition before, but let me just run through it with you. Evidence-based dentistry is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients related to their oral or dental health. And this is why we are so set on changing and on evidence. While saying that to you, I'm also very, very cognizant of the fact that evidence is necessary, but it's not sufficient. It's not everything. We need other factors as well. We need practitioners' expertise. We need to know about the resource constraints. We need to know about patients and their preferences. We need to know about ethical considerations, plus the evidence. So there are lots of other aspects as well. So let's get down to the 5 steps of evidence-based healthcare. And as you must have seen this before, I'm sure it was introduced to you. The first step in evidence-based healthcare is posing an answerable clinical question. The second step would be to find the best evidence, and that's where your searching skills will be required. Thirdly is to appraise and critically evaluate the evidence. based on the evidence on validity, on the clinical outcome and the clinical importance. Lastly is to implement that evidence, and not lastly, second from last, and lastly is to evaluate whether a change in practice or that new method has improved healthcare. So we call it the 5 A's of evidence-based healthcare, the 5 principles. And my focus, of course, is only going to be on the first principle, and that's asking a well-formulated clinical question. The rest of the steps, we leave that to someone else. I see critical appraisal is on your schedule, so we wish well for the person who's going to do that. Why do we ask questions? We ask questions because you can't have an answer without a question. Sorry, I'm just going to move your little things away here. Some questions are self-evident, but others are not. Asking questions helps clarify a problem. Asking questions helps determine the course of action. And that's why we ask questions. So you must also always admit that you don't know something and then seek out the answers for that. So asking questions is key, and it allows you to select the best resource to answer your question or your query. The need for an evidence-based healthcare approach is very important. You cannot overemphasize this because it allows identification of uncertainty or the need for information, up-to-date, reliable, valid information. It's also important because it allows you to improve your knowledge base. And more importantly, it allows you to improve your skills, your clinical practices, but also your educational knowledge that you share with students. So you've got to have clinical format, clinical question. And when I speak about your skills, I speak about formulating clinical questions, your search skills, your appraisal skills, etc. Also, it allows you to improve your research skills. What do you understand by the different research skills? But most importantly, it allows you to change your clinical practices and improve care to your patients. So there are different types of clinical questions. Let's start with the first one. The first aspect that I had to look at was the types of clinical questions. And I'm going to take you through a series of these. The first, just to put them into 2 broad categories, the first type of clinical question is what is called the background clinical question. It's more about asking for general knowledge of a disorder or condition or test or treatment. It's what one would call the textbook information of anything. For example, what are the clinical manifestations of menopause? I'm not only going dental, by the way. I want to show you that we can cross boundaries here as well. Evidence-based healthcare is such a topic. What are the causes of migraines? These are all textbook information. Second type of question that you do get is what is referred to as your foreground question. Here you can ask specific questions, and the questions are very specific, related to knowledge about management of patients with a condition or a disorder. It's also a specific knowledge related to inform clinical decision making. The questions, the foreground type of question is concerns about a specific patient or population. It investigates comparisons, and it is more complex than your background question. And this kind of information, this kind of question, the information that you get here, the questions that you get is from your clinical space, but the answers to many of these would be in your journal articles. It's related to the evidence and to the research that's been conducted. For example, in a patient with osteoarthritis of the hip, is water therapy more effective than land-based exercise in restoring the range of motions of a patient? So you can see the type of question that we ask. It's a lot more in-depth, more complex than, of course, your background question. Background questions, like I said, dental school, basic knowledge kind of questions. Professional practice, your foreground question focuses on professional practice, your clinical practice. It's advanced knowledge, it's evidence-based, and it's very specific. So the clinical work, that's where we get the kinds of questions from. And it's when we treat patients, that's when the questions come up, and they relate mostly to cause and to treatments, and also to how to manage patients for different kind of settings. For example, clinical findings type of questions, etiology, questions that focus on differential diagnosis, questions that focus on different types of diagnostic tests, questions that focus on prognosis, questions that focus on different therapies, preventions, and self-improvement. These are just broad categories. I will go through most of these types of questions just to give you a little bit more an idea of what we're asking here. Let's start with the therapy kind of questions. It questions about the effectiveness of interventions improving outcomes in patients suffering from particular conditions. These are your most frequently asked questions. It would sort of cover questions like procedures, treatments offered by clinicians, medications, etc. Prevention type of questions. These are focused on the effectiveness of an intervention or exposure. Your diagnosis, the ability of a test or procedure to differentiate between those with or without a condition. Your prognosis questions. These questions are about the probable prospect of a patient's disease or the likelihood that he or she will develop an illness. Then you have etiology questions about the harmful effect of an intervention or exposure. And then, of course, your meaning type of questions about patients' experiences and concerns. Just to go through again, therapy questions. Does the treatment do more harm than good or do more good than harm? And is it worth the effort and the cost? Then you have your diagnostic kind of questions. Which diagnostic test is more accurate in confirming or excluding a diagnosis based on certain calculations. Then your diagnostic questions usually compare the accuracy of tests. Then you have your prognosis questions. How do we estimate the patient's likely course over time and anticipate likely complications of disease? Then we have your etiology questions or the harm questions. What causes a healthcare problem or makes it more likely? For example, do tanning beds increase the risk of melanoma? Then you have another example would be, does obesity lead to increased risk of cardiovascular disease? Then you have your prevention questions. How can we reduce the chance of disease? What interventions have proven effective in modifying risk factors? Qualitative or the meaning type of questions would be, how is the person experiencing what is happening to them? What are their perceptions, their attitudes, or their beliefs? So these are just broad categories of questions. I think it's very important to know at this stage, recognizing your clinical questions domain is an important part of evidence-based practice. So establishing the question types allows you to identify the research methodology. Oopsie. I just needed to, yeah. It allows you to identify the research methodology that provides the best evidence to answer the question. Establishing a question, you also need to note the hierarchy of evidence that will differ according to the question type. And I saw in your schedule that somebody will speak about the hierarchy of evidence. Establishing the question type also allows you to select the best evidence-based practice tools to search for evidence. For example, the different databases. How do you know which database is going to work for you? And there are different databases, and some of them are very specific. So you need to know about those as well. Then, of course, establishing the question also allows you to select evidence filters in narrowing your search, giving you the most appropriate research methods. Identifying your question type will also assist you in critically appraising the evidence. Let's just focus a little bit on the different designs for the different types of questions. For example, when you're going to do a study on therapy and the therapy question, you probably would be most probably get answers by looking at randomized controlled trials. In a prevention question, again, of course, randomized trials, but also prospective studies. If you're looking at etiology question, you might have to look at cohort studies that will give you the best answer. And a meaning, the type of study would be related to meaning, you will have to look at qualitative research. And of course, this is the quality evidence or the hierarchy of evidence, and this is what my My colleagues always tell me it's my favorite triangle. And so I like to work from the top end of this triangle. And so most of the research, or the best evidence, of course, comes from the top end of that triangle. Clinical questions, I think we've referred to this earlier on when I said, where do we obtain these from? Clinical questions are usually complex, they are multifaceted, and they arise frequently in the course of our daily practice or work, or even in our teachings. So finding answers to these questions can be very problematic if you're in practice. So if you're not an academic, maybe it's a little more daunting for you to do that. Because of clinical practice time pressures, you might not have the time to go and search for the answers or to develop questions. There might be a lack of awareness of high quality resources for finding research evidence, or the perceived or real lack of skills to formulate appropriate clinical questions, or the lack of searching skills. I mean, these are skills, even if you're in the academics, you sometimes struggle with them, especially if you're not a technology person. But most importantly, the sheer size of the clinical research literature available is enough to make anyone wants to run away from looking at evidence. I mean, I'm not even going to go through all the publications per day. Thousands of articles are published per day, and it's very difficult to keep up with the reading of that. And so there is an efficient method for tackling clinical questions, and I will focus on that a little later for you. But let me start with a clinical example for you, just to focus you as to where and how we get these clinical questions from. For example, a patient comes to you and she brings a 17-year-old daughter, and she says to you, "Doctor, my 17-year-old daughter is going to college next year, and I'm worried about the relapse because she has just completed her orthodontic treatment, relapse due to her wisdom teeth." So she says to you, "Doctor, what do you think? She's never had problems with her wisdom teeth, but should she have her wisdom teeth taken out before she leaves to college? I've heard that they can cause teeth to crowd, and she just got her braces off." So this is typically the kinds of questions that you can be faced with. And these are not the answers we might always have on our fingertips. Okay, so the approach here, or the response, could be one: have them out, I will refer you to a max fac surgeon, or I don't know, I will refer you to a max fac surgeon. Don't have them out, it's not needed. And if I just focus on the first three, it's literally shifting the responsibility onto someone else, not answering without having any evidence. But if you take another approach and you say, "I don't know, I will find out for you and advise you." If you look at the first two, you can answer the patient will be comfortable with your responses, but you yourself as an individual will not have the answer to that particular clinical question that was posed to you. The patient leaves your practice and you set up a cycle of referring every patient based on your lack of understanding of the best ways to manage this type of case. But if you respond according to number 4, that is what we would call adopting an evidence-based healthcare approach. I don't know, I will find out and I will advise you. Whichever way you find out. But at least you will then upskill yourself in terms of answering that question. So let's come to finding an efficient or method for tackling clinical questions. Firstly, one of the methods would be to convert that question into a manageable, answerable format using PICO, PICOS, or its variants. And there are different variants. So this is a format that evidence-based healthcare proponents have advised and have used over the years. You need to rephrase that question simply based on this mnemonic that you've developed or that is available. And you can develop what is called a logic grid using the core concepts of the question. Lastly, you need to explore different synonyms and acronyms for each core concept in preparation for constructing an efficient and effective search strategy. So this is one way of tackling clinical questions. Now, there are different types of research questions. there are different types of questions. We speak very loosely. I said to you at the beginning, we speak about clinical questions and we speak about research questions. And I think it probably depends on where you're based. If you're a practitioner and you're more clinical, you're going to have those clinical questions and you need to then develop them. But if you're a researcher like I am, developing research questions is what we speak about. And so in research, once you've identified a broad area of your topic you want to research, you will then phrase that area into a research question. And there are 3 different categories for that. The first step would be developing a descriptive research question. And a descriptive research question would answer questions like who, what, where, and when. And the kinds of studies you would do here would be your prevalence studies or your incidence studies or even just case studies. The second type of research question that you do get is a question of relationships. How phenomena are related. For example, studies that determine association between low caries and fluoride in the water. So you want to establish that. You want to determine that. Studies, for example, that determine whether complex fillings are more likely to fail than simple ones. That's another example of questions of relationships. These kinds of research questions provide useful information when planning for practices. The third type of research question that you get is that of comparisons. Comparing 2 things to determine the cause and effect. And of course, here classically, you would have your RCT as an example of a research design. So I hope I've clarified at least the differences between where you get your clinical questions and where you get your research questions. Research is also always towards a degree, although not all the time. We do research all the time, and it's not always towards a degree, but it can be towards a degree. Just the goals of these different types of research questions. For example, your clinical questions mostly come from your patients. So it's for your own development at the same time. It's to upskill yourself, to improve your own knowledge. It also answers questions related to your patients and their queries. And of course, most importantly, it can change your clinical practices. So this will focus mostly on the first 2 steps of evidence-based healthcare approach, the first 2 A's. Research questions, however, you can actually do full-blown research with it. It adds to the body of knowledge. You can publish it. Of course, it can change clinical practices. And what's important here is you focus on all the 5 steps of evidence-based healthcare. And that's what's important. So that's the difference between the 2. I think we've come to the end of our first part. And I don't know if you want to sort of take a bit of a break at this stage, Dr. Fariba, because we said 15 minutes. I think my lectures are not that long because, you know, you don't want to overburden people with knowledge.
Yes.
We're still going to carry on with, you know, the format of it, etc. That was literally the introduction to it. So I don't know if you want to take your break now or should I carry on?
Of course, you have time to continue for presentation, but as you recommend, it might be it's better to have a break time for audience before continuing presentations. Professor Khami, what is your recommendations? That Professor Khan continue or have a short break for the audience? Professor Khami?
Somebody said maybe some questions. Of course, we may ask some questions. I think that should be
Dear
quite in
audience,
order.
yes.
I think also,
If
I think at this stage also, carry on, you carry on.
If anybody has questions up to now, you can ask the questions right in the chat box or ask the question from Professor Khan. Can we continue?
Someone said, can we continue?
Yeah, Kumar asked about it or questions. In these 15 minutes, it's the decision of audience. What is their preference? Please continue. So what did you mean by self-evidence questions? So it's better have different idea. I do not know what, Professor Khami, would you please recommend us what to do? Because the different audience has different idea about these 15 minutes.
What you can do at this stage, Dr. Fariba, is share the worksheets with them as well. Maybe you can share those worksheets I sent you.
Okay, can we share it now, Professor Khan?
Yep, you can. Yes, you may.
I will ask the admin to share the worksheet that Professor Khan shared with us, and I send it to you. May I ask the admin to share the worksheets that I sent to you now?
There's a question. It says, what's the difference between the question and the hypothesis?
Yeah. Would you please answer him?
We can answer. I hope I'm able to answer. Anyone can answer, actually, because we don't have all the answers. But I think a research question will focus your research. It tells you exactly what your entire research is going to be about and what it is, where you're going to find the answer. I think when you speak about a hypothesis, for example, if you do a test, you get two different kinds of hypotheses. And of course, most in research, as we speak about a null hypothesis, you're trying to prove something. So it might, it's more sort of direct at your research methodology. Are you going to prove something? A lot of people believe that a research question would be similar to your aim even of your research, but yet it is a lot more focused than just the aim. An aim can be very broad, but a research question is more focused. It is very specific. So yes, I actually meant you can share it with the I don't know if I answered your question. The hypothesis is something which you have to prove, and then you have to say whether you have proven it with your results in the end. Okay, I see now you said you can download the worksheets. Yes, of course, that's what I wanted to say. They can download
Excuse me,
the
Professor
worksheets.
Khan. Hello.
Yes.
The link of these two documents are already shared through the chat box, so the audience can download the file and can have the file to
Thank
fill
you.
it.
Thank you. I see that. Yes.
Dear audience, you can share the link and you can find the worksheet that Professor Khan kindly shared with us.
And remember the question that you must think of.
Yes, the questions should be answered according to the lecture that Professor Khan has about it. And you have any question, you can ask about these questions in the worksheet later. Is it fine, Professor Khan?
Yeah, we can speak about it later.
Okay.
I'm not so sure with what they mean. Yes, someone has asked, Mahsa has asked,
Yeah.
what did you mean by self-evidence question? I don't recall saying self-evidence question. Maybe they can just clarify what it is that they want to know.
Yes, somebody asked about, can we have a short break? Yes, you can.
Okay, sure.
Okay, now the time is 2 p.m. 41 minutes. So about 15 minutes later, we come back again.
Okay, good.
5 to 3 p.m. or 5 to 15 minutes later, we come back. It depends on the time according to different area that different countries that audience are. So in 15 minutes, we come back again. And please, in this short break, look at the worksheet that Professor Khan kindly shared with us and answer the question. And when you come back, if you have any question about this short worksheet, you can ask from Professor Khan. Okay, go to a short break. Have a nice time. See you in 15 minutes later. Professor Khan, I say goodbye to you now. Just for 15 minutes. I'll come back to you soon, okay?
I'm quite fine. I'm just answering someone's question in the chat. That's all. Don't worry. I'm right here.
Great. Hello again to all audience.
Hi, Dr. Fariba.
Hi again to all audience. Do you hear me, Professor Khan?
Yes, I can hear you. I can hear you. Can you hear me?
Yes, it's very clear
Okay.
sound. I can hear you.
Good.
Thank you. Professor Khan, during this time, during this short break, many questions appeared in the chat box.
I can see, yes.
You want to answer some of the questions?
I see some of the questions, and I
Yeah.
think I'm going to answer in the next session, in the next presentations. So
Okay.
maybe, let me see what I can answer now. I'm going to just scan and then see.
Okay. Dear audience, the second presentation, Professor Khan, will be done. And after that, the questions during the presentation might be answered, the question that you have. Is it right, Professor Khan?
Say that again.
Because some of these questions might be answered in your second lecture.
Yes.
And
I will answer some of them in the second lecture, yes.
Yeah, if your question cannot be answered, then
they can re-answer, ask.
Yes.
Yeah.
Then
Do we need to, here's a question. Can I just say, do we need to submit the answers to the questions?
Yeah.
I've answered them on a sheet because this format is not editable. Yes, of course, you can do it. The worksheet is for you.
Yeah.
It's for you you can use it whenever. I've no issues. You can write in there, but I'm going to go through different formats. So maybe it doesn't have to follow that format that's on the worksheet anyway.
Yeah. Okay. So we are waiting for the second lecture, Professor Khan, please.
Yep. We'll start now. I'm just looking at the last question. Factors affecting dental extraction, anxiety, and fear in adult patients. How do I frame the research question for the scenario in a PICO format? Can kindly let me know. I have a question regarding the certificate around the country of reason. I don't know about that. Can PICO be used for other types of studies? What is the difference between RCT and clinical trial? Of course, I'm not doing epidemiology, but I can answer that question for you. To do a primary research, to change a primary question to a developed question, which can make it into a PICO, that's fine. That's quite all right. That's acceptable. You can do that. You can always state a question and you can refine it again even further. Sometimes we develop questions and then they're so broad, and once you start searching, you might realize that you need to refocus that question. But I think I will touch on some of those things. So can we start now, Dr. Fariba?
Yes, we are waiting for you. The question will be answered later.
Yep, no problem.
Thank you.
Where did we jump? Okay, let me just go back to where we stopped. So we stopped and we said we are going to find a way to tackle clinical questions. We will convert it into a manageable, answerable format. I think I do pick up on that again. I spoke about two different types of questions, clinical questions and the research questions for research. So let's pick up where we left off. And we said we're going to tackle it. Convert the question into a manageable, answerable format. And I've given you, it says PICO, PICOS, PICOT, or its variants. And there are different variants. PICO, and I'll go through all what that means, rephrase the question, we'll develop a guide, how we can use the core concepts of the questions, and how we can then effectively develop a search strategy in order to search for proper information and appropriate information. So the approach for clinical questions is you need to translate the uncertainty into answerable clinical questions, develop the ability to formulate precise, structured, answerable questions, and which has been identified as one of the key tasks for clinicians using this evidence-based approach. The questions need to be relevant to the identified problem, and they need to be constructed in such a way that they facilitate searching for a precise answer. So and it's the original format. I've just included this. It is what is called the PICO method. The evidence-based practitioners, experts, have recommended the following steps in formulating a clinical question. But this is not the only clinical question. This is the original format of this question, and it has 4 basic components. It says P for patient or population, I for intervention, C for comparison or comparator, and O for outcomes. So this is the original format. Let me just put it onto our, oh my God, I'm talking to myself. Can you hear me? Are you able to see?
Yes, Professor Khan, we can hear
You can see the screen.
And the screen. Yes.
Okay, you can. Okay, good. I thought for a moment I missed you.
No, both of them are clear.
No, both of them are clear. Okay, sorry. Okay, let me just get back to where I stopped. So let's talk about the original format. The original format that the evidence-based healthcare professionals recommended was the PICO format. And of course, PICO, as you know, stands for patient, intervention, comparator, outcomes. And of course, today, there are many, many different other formats as well. But let's focus on PICO first. Some refer to it as PICO, and that was the original name. Some have now moved on and they're called PICOS. They've called it PICOT. And I'll refer to those different aspects. Firstly, P stands for patient, problem, population. Who does this question relate to? Who's the people involved? The intervention, it can be a therapy, can be a diagnostic test, or can be any concern or issue. Comparison or comparator can be another intervention, another diagnostic test, placebo, or the standard care. For example, you look at the old form of treatment and the intervention would be a new form of treatment, and you want to compare those two. The outcomes, here you must clearly specify what is it that you are interested in. Are you interested in improvement in quality of life? Are you interested in a change in function of a patient? Are you interested in reduction of pain? What is it that you want to know? So that's the outcomes. These outcomes can also be classified into what is called primary outcomes and secondary outcomes. For example, I did a randomized control trial on patients with a shortened dental arch and different forms of shortened arches. And I said, some of them will have a denture and I will replace it up to the 7s, the teeth, and others I will keep it as a shortened arch, and I compared the two. Standard treatment was replacing all missing teeth, and that means making a denture for a patient. The new treatment says, or at least according to my PhD that I worked on, said that patients can function satisfactorily between 10, 20 teeth. 20 teeth and less, let's say. I'm not going to go into the details of it. There are different variations to the shortened arch. So let's say it's a shortened arch versus somebody who has or had all their teeth replaced. So those two you then compare. So that would be your comparator. When I looked at the outcomes of it, I wanted to know whether patients can function with it. I wanted to know whether patients are satisfied with it. So there's patient satisfaction. So those would be your primary outcomes. Secondary outcomes would be things like, did the patient lose any teeth with either one of the two treatments? So did they have to have any extractions with the denture, those who had the denture, those who didn't have the denture? Did they have any periodontal complaints? That would be a secondary outcome. So it's not your most important outcome, but it's also outcomes that you can then establish once you go back and do an evaluation of these patients. As somebody asked in the chat earlier, is it the setting? No, it's the study design. S stands for study design, and T stands for time. So you can decide on your study design that answers your clinical question the best. So for example, if it's a study based on effectiveness or an intervention, of course, a randomized controlled trial would be the best design. And time, of course, could be over time, over a period of time. You can say you're going to do this kind of research, etc., on these patients. You're going to compare these two interventions over this period of time. So that's where time comes in. So that's And these are not the only variations, by the way. This is just the basic variation. Let's talk first about, before I go to the tips, phrasing your questions and building these questions. Somebody asked in the chat, what's the difference between an RCT and a clinical trial? A clinical trial can be any clinical study. There does not, you can have comparisons. I think it's about how you accept people into your clinical study. Now, randomized control trial has a specific methodology, has a specific phase in it. It speaks about accepting people, randomizing people into your study, and then randomizing them into the treatment, into the intervention, or into the comparison or the standard care. So those are specific methodologies. I don't want to add too much to it, but when you randomize people into a study, it could be, for example, we do block randomization, or we say every alternate person, or we say every fifth person will go into this group, and every next 5 people will go into the next group, etc. Randomization has a clear methodology. So if you want to know about how randomized controlled trials work, read up about that. A clinical trial is just any clinical study. Any clinical study where it's not necessarily, they've not been randomized into the study. Of course, the gold standard for any research would be a randomized controlled trial, because what you do when you're very specific about that design is that you eliminate any biases. So that's very important in clinical research. So let's get back to the order, or the work of the day is phrasing clear questions. Tips for building your questions. We spoke about PICO. And if I just stick to PICO for a few minutes, we speak about the patient. You need to identify who the patient is. How do you describe this group that you are so interested in? That's where you speak about your patient or your problem. Okay. The intervention, I said earlier on, could be a new intervention. Which main intervention am I considering? Okay. The comparison could be also another intervention, or it could be the standard care that the patients are normally exposed to. So you want to move on from the standard care and to introduce a new intervention. So you're comparing the two. The outcomes is, what can I hope to accomplish? What could this exposure really affect? How will it change things for us? That's your outcomes. Okay, I've included this table in your in one of the worksheets, so you can always use them in future. Let's get to an example just to make things a little bit closer to home for you. Here we have a patient, and his name is Roger. He's a 26-year-old student. He's been diagnosed with major depression. He has had 3 different antidepressant medications in the past with no improvement. He's reluctant to try a further prescribed medication, and he asks about non-pharmacologic alternatives. You've heard that repetitive transcranial magnetic stimulation has been trialed for treatment resistant depression, but you're not sure if its effectiveness has been proven. You tell Roger you will look into this for him and get back to him. Now, this attitude or this approach that you've adopted is what we call an evidence-based healthcare approach. You get to find out what the evidence says about it. If I move on, just to look at PICO and what PICO says in terms of that clinical scenario. Now, we spoke earlier on about phrasing your question. So you turn it into a clinical, you're turning your clinical scenario into a PICO or a PICOS. Now, we've had the clinical scenario. We know it's a patient with treatment-resistant non-psychotic depression. The intervention is the new thing that you're looking at is repetitive transcranial magnetic stimulation, and the comparison would be other treatments other than the intervention. No transcranial magnetic stimulation. Okay, the outcomes is very clear. You want to have a reduction in depression severity, or you want to put the patient into remission. So that's how you take a clinical scenario and you change it into a PICO. Okay, study designs, of course, you're looking at comparison, you're looking at an intervention, a new a new treatment, and you're comparing to other form. And of course, the standard, the most appropriate design in this case would be an RCT, or you look at the information found in a systematic review of RCTs. So this is how you take a clinical scenario into a PICO. That's step one. Step two, you can take that PICO and formulate it into a proper question. Okay? So let's see. In patients with treatment-resistant, non-psychotic depression, is repetitive transcranial magnetic stimulation beneficial in reducing depression severity and affecting transmission? Now, I want you to see how that was changed from the question into this. Someone asked earlier in the chat about that. See what you can do with your question that you now have. Okay, I don't remember exactly what the question was, but I know there's a question. So see how you can change it using that format. Next, we say create a logic grid for the question or create a guide for the question. What you do with this guide is, firstly, you have to identify the concepts in your question which need to be searched for your search to have minimum level of precision. So you need to look at the concepts that are most important in your question. Secondly, you clarify which concepts can be left out of the search, because you don't also want to add too much information in your question. And lastly, can you find appropriate and useful synonyms, acronyms, variants in spelling for each of those concepts that you've identified? Just focusing back on that same patient, let's look at concept one. We speak about a patient that has treatment-resistant depression. We speak about treatment-resistant depression. And so treatment-resistant depression, that's the first concept you've looked at, and it can be written in different ways. Some people refer to it as treatment-resistant depression. Some will refer to it as treatment-resistant depressive disorder. Some will refer to it as treatment-resistant major depressive disorder. Some will write it using an acronym and say treatment-resistant MDD, etc., etc. So that's how you will then develop a grid or a guideline. So if you're going to search, you actually have to include all of these terms so that you can pick up all the information that's needed. So what this grid does is it helps you find synonyms for those words. And I'll tell you how we can use that a little later on. If you look at the second concept, this is the new intervention. It speaks about repetitive transcranial magnetic stimulation. Repetitive transcranial magnetic stimulation can also be referred to as deep repetitive transcranial magnetic stimulation, or DTMS or RTMS. So it's just the way it's described, the concept. If I look at, I can use exactly the same idea here and say, for example, I want to see all RCTs, studies that have looked at RCTs only. Now, RCTs can also be described in different ways. It can be called an RCT. Some people refer to it as a clinical trial. Some people refer to it as a prospective study. So those are the synonyms you would use for your study design. That's another aspect that you can look at. Now, here's a grid I have for you, okay? It mostly focuses on PICO, but it does have some variation depending on the type of clinical question or research question we are asking. And if I'm going to tell you now, this is the grid that you're going to use often. So keep it with you. It's a good guide, and I will go through it with you. For example, for an effectiveness study or intervention treatment, in patients, what is the effect of the intervention on the outcomes compared to or compared with the comparison within this time period, etc. So you can phrase it whichever way you want to. Now look at the question that I've asked you to look for and see where you can fit it in. What kind of question are you asking? Are you asking an etiology question? Do you want to know the etiology of things? Are patients who have this condition at increased or decreased risk of the outcomes compared with other patients with or without those conditions over this time period. So you can phrase it whichever way you want to. I hope this grid will be of help to you. On the far right of this grid, we also look at this type of study designs that can answer your question. I spoke to you about the different clinical questions earlier on. Here is just a framework to phrase those questions, the approach of it. Of course, it's not set in stone. There can be variations as well. Okay? So if there are any questions related to this, we can speak a little later. Next, we're going to look at the design to answer your question, and I've already referred to some of this in the previous slide, where I said your therapy question, you look at RCTs. Your etiology question, you can also look at RCTs or cohort studies. Your prevention question also looks at RCTs. But I think, as I also said earlier on, the design that answers most types of questions would be a systematic review of, especially RCTs, of all available studies is better than an individual study. Okay? Remember, systematic reviews provide the most valid evidence base to inform the development of trustworthy guidelines and recommendations and for clinical decision making. So it has become, if you remember the evidence pyramid I showed you earlier on, they form the apex of this pyramid. So they have become the most reliable evidence that one can get for any kind of research. I found this while searching and reading around what I wanted to present today. Someone has developed, it's called Ferrugia, developed 2 frameworks for refining research questions. You know the PICO one, and I've referred to the PICO one earlier on. But someone has refined one called the finer criteria for a good research question. What must be in a good research question? What are the criteria for a good research question? First, it must be feasible. Do you have adequate number of subjects, adequate expertise, affordable in time and money, manageable in scope as well? It must be interesting. It must get the answers. Getting the answer intrigues the investigator or the community. It must be novel, must be ethical, of course, and it must be relevant. I think for me, relevant is very important to the scientific knowledge, the clinical and health policy, and to future research. So people have developed different kinds of frameworks as well. So yes, there are other frameworks available. And you know, the world of evidence-based healthcare has expanded so much. So don't think whatever we've given you here is everything. It's not. So we move on, and the next step would be to take all those terms that you've developed, whether it's those synonyms, whether it is the acronyms, etc., and use that in your search. And that step is what we call development of a search strategy. And I think my next colleague will probably focus on that, because they're going to speak about different databases and where you search and probably what you search with. But it starts with the research question. It starts with your PICO. So you've had different synonyms. So for example, population, you describe your population, and you can have different terms to describe your population. And in your strategy that you want to use to search for specific literature or evidence, you can use those different terms in there, and you join them by what is called or, and these are your mesh terms. And I'm not going to go into that, because I think whoever does databases can then speak to you about those mesh terms and Boolean operators, etc., etc. That's a whole world all on its own, and there are so many things that you can learn, but I will give you some examples of those. Then, of course, this PICO terms, you will then join all of those, and we then have what is called the search strategy. Here's an example of a search strategy. I'm busy doing some review with a colleague of mine, and it's based on community-based workers. Community-based workers are also described in the literature as community health workers, or they're described as healthcare workers or primary healthcare workers. So I put all those terms together because they refer to the same individuals or the same group of people, and I will connect it with an or. But in that search strategy, we don't just look at that. Remember, this would be our P. So the first part is our P. Then our I or intervention would be, for example, oral health, maternal health, neonate, all the different areas of healthcare that these community workers work in. So that would be your I. Your comparator would be the services or the context. In our case, it wasn't comparator, it was context. So we look at the different areas of where they're working. And then we had your outcomes. What did it do? Increase access to services, lifestyle changes, increase in knowledge, increase in skills. That's our outcomes. So we connect all the aspects of that PICO question by and. And then you can also add the study designs to it. So the next one is clinical trials, qualitative research, reviews, systematic reviews, all the different types of designs I want to include, I've included in here. These are what I referred to earlier on as your search filters. So this will filter all the different types of research. By the way, this strategy is for what is called a scoping review. And with a scoping review, you look at different types of study designs. That's why you have different types of study designs included in the last part. Just an example, I do have other strategies which I didn't share at this point. But just to give you an example, how we move from PICO, the different aspects, you go to your question and you go to your grid with the synonyms and acronyms and the different variants of the same condition or concept, and you then develop a search strategy which you will use to search for literature. And that's very important. Now you have research and clinical questions, and we spoke about this earlier on, but now also you must remember people do different kinds of research. You get primary research and you get secondary research. Primary research would be your randomized controlled trials, your clinical trials, your cross-sectional studies, cohort studies, your case studies, etc. That's primary research. But you also get secondary research would be your review types. And I'm going to give you a list of reviews that you can do. But you get reviews, different reviews type. And the most classic of all reviews is a systematic review. This is the pillar of all evidence-based healthcare. Traditionally, systematic reviews used to assess the effectiveness of health interventions by critically examining and summarizing the results of RCTs only. But of course, systematic reviews have evolved over the years. Today, you can do a systematic review of only qualitative research. Even in education, people can do it. So you can do different kinds of research, different kinds of systematic reviews. Of course, we said the most effective or the most common one was the effectiveness one. And because these systematic reviews have evolved over the years, the criteria to do these have also changed and has become more rigorous. But I think the fundamental issues primarily relate to the type of questions that's being asked and the type of evidence used to answer those questions. So there are, of course, different types of reviews at this stage that I want you to know about and that you must acknowledge. So in terms of systematic reviews, the question is, and somebody has already referred to that earlier on in the chat, where we said, can we force all clinical questions or research questions into the PICO format? Of course not. It's really impossible. And so you get different formats for it. We know what a systematic review is and how robust that kind of research is. But there are other different types of reviews and synthesis research as well. And if you just look at this list, a systematic review, of course, can end up just being a narrative synthesis, or it can include a meta-analysis. But you get things like a variation to the systematic review would be what is called the rapid review. It has all the steps of a systematic review, but it is not as rigorous or as extensive as a systematic review, but it is almost like a systematic review. Then you have one that I'm pretty familiar with at this stage, is called a scoping review. I've done a few of these and I tend to force my students also to do it, but there are certain criteria set for these, but you also set research questions for these. And of course, then there are other types as well, and I'm not going to go into this, but this is what you call synthesis research or secondary research. It is based on primary research that has been done already. So let's focus on different formats that you get for systematic review type questions. So the most common one we said was the effectiveness systematic review. And here you can use the PICO format, but of course there can be a variation to that as well. So you get different types of systematic reviews, as I mentioned to you earlier on. Some of those would be qualitative reviews, and they answer most of your why questions. And of course, you can't force it into a PICO. So you can have a focus on population, but you can have what is called phenomena of interest or your context. You can change that. If you look at costs or economic evaluation, you can change that PICO into what is called PICOC, for example, population intervention, comparator outcome and context. The prevalence studies or prevalence systematic reviews or incidence systematic reviews can look at COCOPOP, condition, context, and population. So your question format changes according to the needs of your research and what it is that you want. Okay, so there's a reference for you at the bottom if you want to read more about these. I think I'm just mentioning a few more comments on this, but there are variations to these as well. Again, I said the effectiveness systematic review is your most common type, and it assesses the effectiveness of an intervention with one another. And here again, you need to establish a specific focused question that can be utilized to define search terms, inclusion and exclusion criteria. Nowadays, it's possible that almost any type of question can be subjected to the process of a systematic review. Okay, it depends what you want to do. It should be, I think the research question, what it does for you is it provides operational framework for your review, whichever type of review you're going to do. I think when you do a systematic review, you also need to look at, you need to have a critical eye when assisting publications identified. And I'm saying this because we spoke earlier on about clinical questions. And clinical questions, and I said to you, the most valid evidence would be from a systematic review. But at this point, I want to throw in a little spanner in the wheel here with you and say to you, be very critical when you look at evidence that says to you it's a systematic review, because not all systematic reviews are following the strict criteria for systematic review. Researchers would like to do this kind of novel research, and so they've all become involved in conducting systematic reviews. But if you critically appraise those, or you critically analyze those systematic reviews, many of them have a lot of faults in it as well. So be careful when you say, oh, I found this evidence from a systematic review. Be careful that you know what you're looking at and what you're reading. Okay, so my next set would be, Dr. Fariba, another break, where I'm going to do some examples. And maybe I think at this point, it would be good to look at some of the questions people might have, or give people a bit of space to even use those worksheets now that I've given them some kind of format, if there are any new questions. Yeah.
Your presentation was really useful and informative. Do you want to have a look at the questions? If any has the questions that the question has not been answered.
Yes. Yeah. Here's one at the bottom. It says, I get
the question again.
Yeah.
Yes.
And they can let them ask questions. That would be the better way. I guess secondary outcome does not necessarily have to be a negative outcome. No, it doesn't have to be a negative outcome. It doesn't necessarily have to be a negative outcome. I agree with you on that one. It can be good. It can add more to your research than it just being a negative outcome. In the first worksheet, I think the S stands for, if it stands for setting, it's fine, but you can change it accordingly to the way you want it, as long as you're specific about what it is. Let me just have a quick look at those sheets that I sent you. Type of question, type of study design. It speaks about study design. So I would assume it is S for study design. T is for time. T is mostly for time. I think the S here would be study design because it speaks about study design. PICO format, type of question, and then it says identify the type of study, and it gives you different study designs at the bottom. So I assume it speaks about study design. The next question says about databases. In systematic reviews, we see different numbers and types of them. Would you please, whichever is better to be searched, and what is the minimum? Oh, that is a loaded question. That is a loaded question. You know, when you look at databases, they are like a nightmare. I can use one strategy today, and I can search for articles, and tomorrow I can use exactly the same strategy, and I will get a different set of articles or different numbers of articles. So these things have a mood of their own. So unfortunately, yes. But of course, you need to be very specific. You also need to know where to search. You can't look for clinical research under qualitative databases. And that's very important. So I think the next presentation for the next day, Dr. Fariba, would be on databases. So they can maybe highlight to you what kind of databases are for which studies. They can probably focus and talk to you about grey literature. Where do you find grey literature? Those databases, those kinds of things. So they can speak to you about that. Minimum, sometimes, I think it depends on your question. I'm doing some research with some of my postgrad students and even colleagues as well. And you know, on some days we get thousands of papers. And if you then sort of go through those thousands of papers, and in order to avoid that kind of time wastage, you have to be specific with your questions. So I'm talking about the research question, and I can't tell you how important it is to be specific about your research question, to be very focused, because that will change those numbers drastically. Yes, of course, you know, you can have thousands of papers on a topic, but you don't want to get thousands when you search, and then once you have gone through each one of those, and there's a 3-step process that you do that. For example, you look at the titles and you say, oh my goodness, this is focusing on a topic that's totally out of mind. So what happens in those databases is, for example, if you use the word healthcare, you use the word healthcare, and the word healthcare is picked up for everything and every little article that has the word healthcare in it. So you don't want to do that. You want the database to be very specific about what you want. I'm doing a study with a colleague of mine, and she's doing it on oral health promotion interventions. And you have no idea how it picks up the word intervention, and it gives us studies that we don't want to include at all. So it's very difficult because certain databases do that. Others, on the other hand, don't. So for example, with the same strategy, you get with one database, you'll get thousands of papers, but with another one, you'll get hundreds. So there are big differences in those numbers. So it's never, you can never really put a number down and say, you know what, this is the minimum you should have, this is not. I think the whole idea is to focus your question. Make your question very focused when you do it. What appraisal tools do we utilize? I don't want to crash in on someone else's topic. I think someone is going to do critical appraisal, and I see it's a very extensive schedule. So I think when you sit in that presentation, they will speak to you about appraisal tools. There are lots. Different groups develop different appraisal tools. I have found 2 that work really well, and they have different appraisal tools for different studies. For example, the evidence-based healthcare group, the evidence-based medicine group, they have tools, but also the Australian-based group called the Joanna Briggs Institute, they also have lots of appraisal tools. So I always refer people to those. So those are just broad areas, but I'm sure whoever's going to do appraisal tools with you will do that with you. The next question, for doing a systematic review on RCT, studies must be considered, or other studies like case control cohort, and can also be included. Okay, now you know, they say the most The most classic systematic review is one where you only look at RCTs. Okay, luckily I've done one of those, but you know what? The world is not only about RCTs. We love to do RCTs. And let me tell you, once you've done one, it's a good space to be in for yourself as a researcher. And I've been fortunate again. I've done an RCT. Okay, it's a beautiful study design. I think it has the structure it's well laid out. So yes, doing a systematic review with only RCTs is the classic. It's the best thing to do. But unfortunately, people do a lot of other studies. I'm currently busy doing a systematic review with a colleague where our studies are all lab-based studies. It's on nanoparticles. And I said to my friend, you know what, take your nanoparticles and go. I don't want to do that kind of research. I don't do lab studies. I want to do clinical research. But you know what, that's just the nature of research. You get all kinds of research. So yes, you can do a systematic review with different types of study designs. So you do have that. What you need to do is you need to know how to appraise each one of those. So when you're going to include different study designs, you get different appraisal tools for different types of study designs. RCTs, you'll have specific ones. And I don't want to promote, but of course I can promote. I follow the Cochrane collaboration groups. So I follow their systematic review guidelines. So if you go into the Cochrane database, you'll see all the systematic reviews and they are very comprehensive. But your everyday journals don't want to accept those systematic reviews because they're so extensive. So you don't have to follow that format, but you need to follow a format. You can't say you're going to do a systematic review and you don't do appraisal of it. You can't say and call it a systematic review if you have not followed those steps of it. You at least need to follow the basic steps of a systematic review. When you're going to include different study designs, yes, you do get tools for case control studies. You do get appraisal tools for cohort studies, and you have to then include all of those. Even for the lab systematic reviews, the systematic review on lab studies I'm currently busy with, there is an appraisal. We have found an appraisal tool for it. So we're going to include that because that gives us that will make our systematic review more reliable, more valid, and more credible. And that's what we want at the end of the day as a researcher. You want to publish credible research. So that's where we are. I hope I've answered those questions.
But I have a question. May I ask my questions?
Of course you may. Of course you may. I hope I can answer you though.
As you kindly explained, RCT is the best type of research. But
yes.
Unfortunately, it's not easy to be done.
No, it's not, especially with COVID.
Yeah, exactly. But not considering the COVID, but I tried to do several times with the RCT, but it's really difficult. It's easy to say, but performing and designing and performing the study is really difficult to be done.
Yeah.
And one question I have, synthesis research that you explained about it. You explained, as I remember, you explained that everything cannot be performed in a systematic review. Is it right? Any question?
Just repeat that again. Do I understand you right?
Synthesis research. Is it right?
Yes. Synthesis research. Yes.
Yes. I think you explained that all the questions might not be answered and might not be done as a systematic review. So you recommend synthesis research. Is it right?
Yeah. Okay. Let me get back. The classic type of synthesis research is a systematic review.
Yeah. Would you please
the classic type of synthesis research is a systematic review. But that type of synthesis research has evolved. So now you get different types of synthesis research. So you get different types of reviews. And when I say reviews, and yes, somebody has just posed a question, Dr. Kumar has posed, what is a scoping review? And so I'm going to hopefully answer him as well as I speak about the different types of synthesis research. You know, in the past, when we used to get literature reviews, they were very unstructured. People used to, for example, you have your area of interest, you search the literature, you take all the articles that you think are of interest to you, and you include that, and you call that a literature review, and we used to publish that. When I say in the past, I mean 20 years ago, even 10 years ago. You'll still find some of those. But we've now discovered and we've learned with a systematic review that you need to adopt a structured approach so that you don't exclude any research or any studies. For example, now you say, okay, this is my area of interest. This is my broad area of research. I want to do synthesis research, whatever type of review, and I'm going to develop a research question for that, and then I'm going to search. So you follow these steps of evidence-based healthcare, this evidence-based approach, and you search different databases, and you will find those articles. For example, if you do a systematic review, the minimum number of databases to be included is 2. Now, as a researcher, I still think that's too little. I will say include more databases. So what you then do is you search all those databases using the criteria that you got from your research question. You developed it into a search strategy, and you will find articles. Now, already, just by doing that, you have developed an objective approach to the literature you find. So now you can then analyze that information in a structured way. So that is synthesis research. That is what a review is about. A scoping review, now systematic review is clear. It can be any kind of clinical question. And it can be, you can have systematic review with only RCTs. You can have systematic review with only qualitative research. You can have a systematic review with mixed type of designs. So that's a systematic review. A scoping review, on the other hand, is a type of synthesis research where you look at a topic that's very novel. You don't have, you want to know, for instance, what kind of research can I do related to nanoparticles, for instance. But nanoparticles is not so, it's not so common. People haven't done so much on it. So I want to see what research has been done related to nanoparticles. Nanoparticles in any kind of sphere, whether it's composites or anything else, right? I'm just talking broadly. So you say, okay, my broad area is nanoparticles. I want to see what kind of research has been done related to nanoparticles. Then a scoping review could be a type of review you can do. You will look at, for example, you'll develop your research question, you will have criteria, you'll develop your strategy, you'll do search different databases, and you'll get all the articles related to nanoparticles. And you will say, okay, so I'm going to look at what kind of lab research was done with nanoparticles, what kind of clinical research was done with nanoparticles, what kind of synthesis research was done. Did anybody do systematic reviews on nanoparticles? So you first look at the designs. Then you're going to go further. And whilst doing this, you are appraising those papers. You haven't even used a tool yet to appraise, but you are already appraising. You are reading into those papers and seeing what research has been done. And then you say, okay, my interest is to do clinical research on nanoparticles. They've only done one cross-sectional study there. Let me see if I can do an RCT. No one has done an RCT on nanoparticles. So that's what a scoping review does. It actually helps you, it guides you to identify research gaps. So that's what a scoping review can do.
Thank you.
I hope that answers your question, Dr. Kumar.
Yeah.
Can you summarize the last question about systematic reviews and other studies? The last question. Can you just, which other question are we talking about now? Which last question? I don't know where we are.
The last question was a scoping review, that you clearly defined it and what is the meaning. And he or
I think I answered. Did I answer? I can't say the name. Sorry.
Yeah.
My apologies for that. I hope I answered. If I didn't, please rephrase. then I can answer. Any other questions?
Apparently, you answered all the questions that has been written.
Okay, good.
Read it one by one. Thank you for that. I appreciate it. Can we go for the next section, next lecture?
Yes, we can. I think my next section is just literally on examples of research questions,
Okay.
which you can use, which the delegates can use. They can look at it. They can, if they don't have their own question, they can try and put it into those worksheets I've given and ask questions related to that. So can you hear me now still?
Yeah.
Okay, so let's look at examples of clinical questions. Again, as I said to you, this framework is very helpful. I use it all the time. I give it to all my postgrad students and to my colleagues to use as well. So it's a good tool to use. So that's my suggestion to you. Keep it at hand and see if you can frame. Let's get back to the question that we had originally as part of the presentation about the young lady that's off to college and her mom is worried that she's going to have ortho relapse due to her wisdom teeth. Okay, so the question is, what do you think, doctor? She's never had any problems with her wisdom teeth. Should she have her wisdom teeth taken out before she leaves for college? I heard they can cause the teeth to crowd and she just got her braces off. So let's develop a PICO for that. Let's create a PICO, right? Remember, we said PICO, we said patient, intervention, comparison, and outcome. If you look at the patient, it's an adolescent girl, good oral health, good oral hygiene, impacted, asymptomatic third molars with no evidence of pathology. Now this P is described extensively, it's very comprehensively described. We don't always have to take everything into that question. Your intervention would be, you could have her wisdom teeth surgically extracted. Comparison would be to leave the wisdom teeth where they are, monitor, wait, and observe. And the outcomes is to see whether there's going to be ortho relapse, surgical complications, other issues. Now, in this case, if you look at outcomes, your primary outcome would be ortho relapse. Surgical complications could be a secondary outcome or any other complaint she might have. So you will then form that into your question using that format. That's one example of a clinical case that we have. Here's a question that I have developed for, this is from RC. Yes,
sorry, I interrupt you. Would you please share your screen? Because
did I not share the screen?
No.
Oh, sorry. I thought it went straight to that. Okay. Let me go back.
Yeah, please. And if you share the worksheet that you have, at the same time you read the scenario, the audience can understand it better.
Yeah. Sorry, I didn't share the screen.
No, but
let me go back. I spoke. I only spoke.
Yeah, you just speak, and so I think the audience could not understand it properly.
Okay. So yeah, this is the. This is. Are we okay now?
Yeah. Would you please repeat from the first, because some audience could not understand it properly. If it's possible for you.
This is the first slide.
Yeah.
So we're going to do examples of clinical cases. So this is a framework I said you must try and keep at hand.
Yeah.
It is just ways of phrasing your clinical or your research question. It's a good guide. It can help you. So you can look at these and use this as a guide. So the first question, first case I looked at was the one I referred to earlier on in the presentation about the young lady who goes to university and she's had her ortho treatment completed, but she's now got her wisdom teeth coming out. And her mom is worried about the impact of the wisdom teeth on her current setup. So of course we use the PICO, patient, intervention, comparison, and outcome. And that's what we're going to use in her case because we speak about the patient, adolescent young lady, good overall health, good oral hygiene, impacted asymptomatic third molars with no evidence of pathology. And of course, like I said earlier on, it is a comprehensive description of your patient, but you don't have to always put all of that information in the question. You can just take the most important aspect out. Intervention would be, should she have her wisdom teeth extracted? That's surgical extraction, of course. Comparison would be not to have those wisdom teeth extract, monitor those and wait and see what happens to her current setup, what happens to a teeth that has just had orthodontic treatment. And the outcomes, of course, would be, is there going to be ortho relapse with the wisdom teeth present? And that would be your primary outcomes. You're most worried about, she's most worried about ortho relapse. Okay. Secondary outcome could be your surgical complications, because if you're going to have surgical extractions, there could be complications with that. So you can then even comment on that or any other related conditions. That's case one. Okay, just an example of a case where you have it in its PICO format and you can work that into, and of course, like this would be an effectiveness question. So you would put it classically into that PICO format using the framework I've given you earlier on. Here's a question as well that I've done. This is the RCT that I've done. And the question was, in partially dented adult patients, what is the effect of not replacing all posterior teeth, missing posterior teeth, on daily functional needs and quality of life? That is your outcomes. Are we okay? You can still hear and see me?
Yes, Dr. Khan, we have your video.
Okay, good. Compared with replacing all missing teeth with our RPDs over time. Okay, so that was the research question for my randomized control trial. Next, now what happened? Okay, that's example 2. Okay, example 3. Here's a question for you, and you can see if you can answer it and see if you can put it into that classic format. We have a diabetic patient that presents to your clinic requesting a scaling and polish as she was experiencing some pain on her lower gums. On intraoral examination, she presented with signs and symptoms of ANUG, acute necrotizing ulcerative gingivitis. You decided to prescribe metronidazole for 5 days and informed her that you would complete a scaling and polishing once this infection has resolved. She then speaks to you and she says to you, she wants to know if you can't just give her the new mouthwash her husband told her about. So here you have your patient, diabetic, that's your P, the outcomes, you want to have resolution of the ANUG, you have your normal standard treatment, which is your metronidazole, and you have your new intervention, the new mouthwash. So you can fit that also into your PICO. Example 4 would be patients with a severely resorbed lower ridge, generally experience pain under the lower dentures. You wonder whether the application of a rubber base to the inner surface will reduce the pain experienced by these patients. So you can put that into that format as well. Okay. Last example here, just to take you out of dentistry, for example, a patient, a smoker of more than 30 years has come to you asking about something unrelated. You ask him if he's interested in stopping smoking. He tells you he's tried to quit smoking unsuccessfully in the past. A friend of his have successfully quit with acupuncture. However, should he try it? Other interventions you know about are nicotine replacement therapy and antidepressants. So you can take any clinical scenario and put that into your format and search for the most appropriate literature. Okay, here's a few examples of review research questions. Here's one I'm currently busy with, and we've tried to put it, it's not necessarily your classic PICO because the C is not your comparator, but it's the context that we're busy working in. And the question we said was, how successful are programs delivered by community-based workers in improving health outcomes in community settings? And here your population would be your community-based workers. The I or your intervention is your program. Any kind of healthcare program that the community-based workers are involved in. And the context, of course, is healthcare sector. the outcomes, increase access to services, lifestyle changes, etc., etc. So you can list your outcomes, whichever outcomes you want, okay, that are most appropriate to answer your question. So there's another format for you. Here's a few more questions. I'm busy with a digital workflows review, just to identify the research using a partial or complete digital workflow. So you can imagine that question can be transformed and written very differently because it focuses on two big areas of digital workflow, partial or complete. Then we have another one. What are the oral health behavior change interventions that are effective in improving oral health behaviors in 8 to 18-year-old children during oral health promotion? And let me tell you, with this review, gosh, it was a pain to search certain databases because they were giving you thousands of unrelated, as I said to you earlier on, unrelated articles for this review. So it was difficult to search. So some of them are not that easy if you know what I'm talking about. Here's one very closely related to the space we are in. And I did this review with colleagues of mine in my department about the infection control and transmission measures that can be identified and inhibit the spread of SARS-CoV-2 or COVID-19 in a dental setting. And the unfortunate part with doing reviews in, and this is a scoping review, of course, because there's not a lot of primary research. Primary research is only coming out now. From the time we submitted this review to the journal to the time the reviewer sent me comments, I could have updated the search because there was primary research at that point. But initially when we did the search, there was nothing that we could find because, as you know, COVID was something that none of us were faced with in the past. So yes, that's where you want to classically do a scoping review. Here I have one, the nanoparticle systematic review that I'm busy with. Does silver nanoparticles inhibit the growth of Candida albicans in dentures and denture liners? And then we established a PICO for that one. And this is what you would call your effectiveness systematic review. Okay, so there's another example that you could use. In another one that I've used, I think this was the question, the effectiveness systematic review that I've conducted, and it's been published a few years ago already, to identify and analyze clinical trials which could compare functional outcomes of prosthodontic interventions used for treating shortened arches versus unrestored shortened arches in partially dentate adult patients. So this question, we also classically use the PICO format. Yeah. And of course, I included the S for the study designs. So here you classically have your clinical trials that are included because I only wanted to use, I used the word clinical trial here, not randomized, because then it would have excluded the non-randomized clinical trials. So I included randomized and non-randomized clinical trials in this question.
Professor Khan,
Yes.
I have a question now.
Ask, please ask.
Sorry, thank you. It is not my question. It is this question is from one of our lecturers for the next sessions,
Yes.
from Professor Ahmad Reza Shamshiri. In the start of your lecture, this question was written, and now I read it because it's related to the PICOs.
Yes.
Professor Shamshiri asked that in the first worksheet regarding PICOs, is some references. S stand for setting. Example in clinic or in hospital.
Dr. Fariba, I answered that question earlier on. Okay. I answered it. I did, okay. Yes, I did.
Okay, thank you.
Yeah,
thank you.
I did. I went back to the worksheet and I can do so again after we've completed here. Then I'll do so again to show that the S is for study designs, because on that worksheet, it was specifically for study designs. Okay. They didn't speak about settings. And the settings would refer to the context. Yeah. So it would be, if you look at the systematic review questions, and once you've looked at this presentation again, you'll see the systematic review questions speak about context, not settings.
Okay, thank you.
Yeah.
I'm sorry.
No problem. Yeah, no, it's okay. Then here's one. Oh, here's a research question. I did what is called a overview of systematic reviews as well, and it's published as well, where it also has a particular methodology. It's also synthesis research, but what I was looking at is only systematic reviews related to a particular topic. And then I synthesize that. And the reason you do that kind of research is to strengthen the evidence for any kind of review. For example, you have your evidence, your primary research, then you do a systematic review and you say you've now looked at all the primary research related to that topic and you've synthesized all of that. And so it can either strengthen the evidence for that topic, and so you can do that. So you do a systematic review. But then you can do on top of that research, I almost, my colleagues laugh when I say that is the third step in doing synthesis research. But it's just secondary research, don't worry. So it is looking at systematic reviews and strengthening the evidence related to a particular topic. So what I've done here is I've looked at all the different types of, all the different systematic reviews related to shortened arches, and I've combined that, and that also then speaks to strengthening the evidence. Another type of review that does that would be what is called an umbrella review. It also does that, strengthens the evidence related to it. So you bring together other reviews and you say how strong the evidence is related to something. And my topic, of course, was the shortened arch. So I wanted to see the strength of the evidence for the shortened arch and how it can change practice. And that's why that was important to do. So this is what the question for a systematic review, for at least for an overview of systematic reviews. So when I say the study designs, I speak about high quality systematic reviews related to the SDA concept and its variants. And I looked at function and oral health quality of life. So that's where we are. Any questions, comments, clarifications, anything else you want me to do? We'll speak about that. Lastly, anybody wants any information from me, that's my email address for you. You're most welcome to contact me.
Thank you, Professor Khan. Would you please answer, according to the last explanation, somebody asked about Kumar, asked, is it called as systematic review of systematic reviews? You explained just now about the shortened dental arch, or some such article published?
I'm sure they call it systematic review of systematic reviews, but you know, if you call something a systematic review, it must follow the guidelines of a systematic review. When I did an overview of systematic reviews, it was a similar methodology, because your research question is the same, your searches are the same, you develop a search strategy for it, your searches are the same, you also have, but you must have a certain number of databases. So for example, if you're going to look at an overview of systematic reviews, you need to have at least 4 different databases. You need to at least minimum use 4 different databases to search for appropriate literature. So yes, they do. So I'd be careful. Those are like one of those where I would say, check what kind of systematic review it is, because everybody wants to do a systematic review, but are they following the steps critically for a systematic review? So be careful when you do read those. Because it says it's a systematic review, can you trust the information coming out of there? Nobody wants to downplay or downgrade anybody else's research, but unfortunately there are people who are haphazard about those things. So make sure it has all the features in it before you accept those outcomes. So yes, of course, that's important. Yeah.
And
Any other questions?
yeah, surgery
Do we-
first, orthogonatic approach versus conventional orthogonatic approach. Systematic review of systematic review. I
Yeah.
think it is the
Yeah,
same.
yes,
It
same
is the
comment that I have.
Yeah,
You
yeah.
know, we have, for doing reviews, can we conduct surveys and based on that combine the results with earlier published results? It depends what kind of review you want to do. Like I said, a survey is, for example, a cross-sectional study. If you're going to do a review, you want to maybe include all mixed designs, then of course you can. Yes, of course you do register systematic reviews before you conduct them. You can register them with Prospero. You can register them with the Cochrane database if you want to do a Cochrane systematic review. I did write my email address.
Yes, please.
Yeah,
Somebody
I
asked
did
it
write
for,
it. Yeah.
because your last slide was disappeared very soon.
Yeah, no, that's fine. I wrote it there twice already.
Thank you.
So you have to register those systematic reviews, and Prospero follows a set pattern for, and in even Cochrane, the Cochrane database, you register your title first so that they can check to see nobody else is doing that. So if you've registered your title, it's registered. And if somebody else then comes to register the same title, they will refuse it. They will say someone else has registered the title already. And even if it's similar, they won't take it. They won't accept it. Yes, you have to register your protocols, especially for systematic reviews, because when you publish your paper, the journal also wants to know whether you've registered your systematic review. Now, remember, systematic reviews do not have to be registered at institutional level because it is not research. You don't have to register it for ethics because you're not working with people. You're looking at articles. So a systematic review would not really be registered. So you don't have to necessarily register it, but you can register it if you want to. You can register it on the specific databases that's available. So you can register it on Prospero, I said, you can register it at the Cochrane database, wherever you're going to conduct it. So, so when you publish it, you can then say, you know, you've registered it with. I've also discovered, because I was looking at the protocols, for example, you can publish that as well. And institutionally, we also have a site at our university where you can publish your protocol. It can have access to people and they can comment on it. But there are sites where you can publish it worldwide as well. The name of the site has just gone out of my mind now, but I've discovered the site when I was looking at where I can publish a protocol. I've now submitted a protocol for a systematic review where you publish the protocol as well. So instead of just getting one publication out of a systematic review, you might get two. So you can do that as well.
Professor Khan, somebody asked, would you please write the address of systematic review, but you explained that you have forgotten, unfortunately, the name of the address and the address of the
Cochrane database. No, yeah, these are the two sites. These are the two sites where you can register a systematic review. You start with the title, and Prospero, you have to have your protocol in place in order to register it. But there are other sites as well. Maybe I can share that with you at a later stage, Dr. Fariba, and you can share it with a group if they're interested, or maybe I'll put it on the WhatsApp group if I find it.
Yes, because
you do that. Yeah. Yes. So, any other questions related? We've done the research question, we've done clinical questions, we've done the formats, we spoke a bit about reviews. Any other questions I can answer? I'm at your service for now still. I don't know till what time are you going?
The topic is difficult. If I want to have some question, I should hear your voice again and again to understand it properly, and then ask my question.
No, of course it is. The topic is not, it's not easy.
No, not at all.
And once you've done it a few times, it's easier to speak sometimes about it, but once you've actually done it, it shows you different things. And you know, this topic of systematic reviews and research questions, they evolve all the time. They evolve all the time, and there are so many changes that you have to be aware of. So I can tell you something today, but in the next year there might be other changes.
Yes.
I'm busy doing scoping reviews, and yesterday I discovered, oh my word, you can critically appraise a scoping review, and yet the initial aspects of a scoping review, they said you don't have to critically appraise it. So you know, there are different opinions as well.
Yeah, exactly. Professor Khan, before
There's a
I read
question.
the next question, several audience asked for your email address. Would you please write?
I did. I typed it twice. I typed it twice in your chat. So if
And-
they go up on the chat, they'll see it there.
But I didn't see it. Would you please repeat again? And then we go to the last question that is now is written. Thank you. I appreciate it.
No problem. No problem.
Thank you.
Not the 5. Sorry. Oopsie. I don't know where the
It's not
5 came
appropriate.
from. uwc.ac.za. iscan@uwc.ac. There we go. So yes, of course. Is it right that when you haven't written on a subject, you can't do a systematic review on such a topic or subject? I'm not so sure what that is. I don't know where that comes from. No. Nobody says you can't. Nobody says you can't. You can choose, you know, and we say this, and COVID has actually pushed us to this level where we had to say to students, you can't do primary research because you can't see patients now. So the best way to do, even for your masters, is go do a systematic review or go do a different kind of review. I offer different reviews because I know the different reviews. Not everybody it's not everybody's interest. So yes, you can do a systematic review. So it became an alternative for people to actually do a systematic review instead of primary research. And let me tell you, it is no easy thing to do. It takes you more than a year to do. It can solidly be a systematic review for a master's degree. So you can do a systematic review for your master's. And no, you don't have to have been able to write on the subject matter before. You can find any area of interest and say, okay, you know what, I've looked at this and there's so much primary research here, but there's no systematic reviews on it. I've had a student of mine, and one of somebody that commented earlier on sounded almost like but I've had a student where she had to do, we're busy with research on implants, and she then searched for systematic reviews on implants, and she found lots of systematic reviews on implants. And so, you know, there's subject matter out there. You just need to search for it and see what there is. And if there isn't, then you're allowed to go and do that systematic review. Nobody can stop you from doing it.
Okay, thank you.
Any other questions?
The last question is that your email address still is not visible, and I cannot see it as well.
So it's privately. It says privately every time.
You told that several times in it, but we could not see it.
I have no idea. I'm typing it into someone else's word, into someone else's. Okay, I tell you what we do. Let me go to chat.
Yeah.
But it's against someone else's name. Send to the chat.
In the chat.
Send to everyone in the meeting. Okay, I think that's what it is. It goes to someone else. I don't know where that changed. That wasn't me. That's why they keep asking. Can everyone? That's for everyone.
Thank you. Just now it is observed. Everybody can see it, and I can see it as well. Thank you.
It wasn't me. It was anyway. Okay, now there we are.
Yeah, 2 days. Many of our audience are students, so
are they students? Okay.
And the topic you present is really difficult, even for me and even for many faculty members. So
I'm still learning. Don't worry. I'm still learning.
And still, I need to, as I told you, read it several and hear it several times in order to know and understand it properly. And somebody asked that whether this presentation is recorded or not. Yes, it would be available in the website. You can have an access to it later after it is prepared and listen it several times. Any sessions is recorded, as also it depends on the allowance of the lecture, that whether it is allowed to be recorded or not. But as far as I know, all the lectures are recorded.
You may share it with me. You can share it with me.
Yeah, sure. I will do it. I will do it. Professor Khami, please.
Any other questions?
Yeah.
Which website? They're asking you which website is it on?
That in the booklet, the website of Tehran University in the International Affairs has been addressed, and the audience and the participant can refer to and have an access to it. Professor Khami, if you have any advice about this issue and this question the participants have, would you please explain about it? Yes, the address has been written here, Tehran University of Medical Science. You can see it, save it, refer to it, and you can have an access to the recording of the lecture, of all our lectures. Is there any question that participant and audience have? And before finishing today's session, we can...
Okay, may I just add a comment, Dr. Mutawassilian?
Yes, please. I hear you.
Yes, okay. Once again, thank you. I want to thank also Professor Khan for the nice lecture and how she could cover this important topic. As we can now see the feedbacks, so many of the participants, they are saying that it was a great lecture. But just I want to say to those who might be, because as Professor Khan nicely said that we don't know about the knowledge levels of our participants, and we have many participants, so and they are not at the same level. Mm-hmm. So for those who might have some more questions, or maybe need some more information to completely understand the lecture by Professor Khan, I just want to say that, as I told in the first session, that we have a spiral design for our course. So we will go deeply to these, for example, critical appraisal of systematic reviews and randomized controlled trials in our next sessions. And also we have a session completely devoted to databases, how to search databases. So I just want to say that they will have more insight in our next sessions regarding the topics that they might think that at present they are somehow confused with that. But they think that I think today the topic, how to define a clear question, was nicely covered and presented by Professor Khan. And again, we have time. If you have any question, not in this session, but if you have any question, you send your question in that WhatsApp group, or you can also send emails to us, to me, to Dr. Mutawassilian. And we are also in connections with the old lecturers, including Professor Khan, so we can have some discussions with them and provide the answers to your questions.
Sure.
Yes, thank you you very much. So that was my comments regarding the course.
Thank you. Professor Khan, I really enjoyed your presentation.
I'm so glad. I just want to echo what Dr. Khami was saying, that they must stick with the other presentations as well that's coming for the next few days. You can't do the one without the other. You've got to attend all the presentations, because as you could see from those 5 A's, they all form part of a package. So my advice to the participants is, please attend those sessions. They are most important. Your other questions will then be answered as well, like the databases, the searches, as well as the critical appraisal. And it's very difficult to explain critical appraisal. So sit through these presentations. It's a good guide for you. So that's my advice to them. Please attend. Please attend. It's wonderful to learn about this thing. And it's a beautiful world to be in terms of research.
Thank you for
And thank you for the opportunity, everybody. And thank you for all the kind words, even in your chats. I'm looking at them. So thank you, people. Thank you, everybody.
We are thankful to you to share your the knowledge of you have, your absolute great knowledge you have with us about the systematic review, defining a question in PICO. I hope we can have in near future another session with you about systematic review, how we can do it, the critical appraisal, any topics you have you are expert in. It would be our honor. Thank you for the time you taken with us.
You're most welcome.
I
see somebody has asked for a copy of, if you want me to, I can send you a PDF of the presentation.
If you allow us, yes, if you allow us, you can share it. We can provide an access for the audience to see and have an access to the PDF, the PowerPoint you kindly prepared.
You're welcome. I will do so. Thank you. Take care.
Thank you for participation. Best wishes for you, and bye-bye.
Thanks so much. Bye. Bye, everybody.
Before saying goodbye, just I want to say that we can have a group photo as we had in the first session.
Oh, okay, sure.
Great.
Yes. So please, if all the participants, those who are willing, please just turn on your cameras, and then we can have the group photo.
Sure. Are they turning it on?
Yes, they are taking. So, so my colleagues, please tell me if it has been completed. So
we are waiting for the audience to start their video.
Yes. Okay.
And please share such a photo with me, please. Send it to me.
Sure.
So if you're ready, we're gonna to take a picture.
Yes.
Thank you.
Oh, there we go.
Yes, that's it.
Thank you.
Okay, thank you very much.
Thank you. I appreciate it.
Okay.
Thank you.
Thank you all.
Thank you for all.
Thank you all.
Bye-bye.
Have a nice time. Bye-bye, everybody.
Bye.
See you for the next week on Wednesday at 2 p.m. at local time of Tehran. And you should change it to your local time of your area that you reside in. Best wishes for all. Bye-bye. Professor Khan, thank you. Bye.
Bye, Fariba. Bye-bye, dear.
Thank you.